your dog just had a spinal surgery or he's recovering from a spinal pathology. We are going to give you some tricks and some maneuvers that you could do to help them recovery through this time. In a second, we will demonstrate on Ginny, and she's going to be super helpful on showing you how to do it with your dog.
So we will now perform physiotherapy on our patient. There are 2 stages involved in a patient's passive physiotherapy. These include massage, which there is effleurage and petrissage, and passive range of movement. We will begin by performing gentle massage on the patient's limbs, working from the paw up to the hip or the shoulder. We do this to increase blood flow and reduce edema and warm up the muscles prior to any movement. Starting with effleurage, we begin by making stroking motions using either your thumbs or hands, depending on how large the patient is, from the paw upwards. We would ideally like to do this around 5 minutes. We would then move on to petrissage, where we would make circular kneading motions, moving from the bottom of the leg up, again for around 5 minutes. After we have performed the massage, we would then move on to PROM, or passive range of movement exercises. Start by moving the joints of the patient within their individual range of motion. Starting with the individual toes, then working up the leg with each joint, ensuring you support the joint as you go. We would also encourage this type of movement to facilitate airflow between the toes and decrease the risk of dermatitis. We will also stretch out the legs, including the hips, to release any tension and increase a patient's flexibility. We would then start bicycle movements, moving the leg in a bicycle motion, essentially mimicking their typical pattern of walking. Extend and flex each joint as you go. We would do this for around 5 minutes, or 15 to 20 movements per joint. Ensure the above processes are repeated for each individual limb. Ideally, we would do the previous tasks before walks to aid stiff patients' movements. If you feel your dog is uncomfortable, please let your vet know, as this process shouldn't be painful and may indicate they need additional pain relief. Next, we will demonstrate how to express a patient's bladder. Place your hands on the patient's lower abdomen and place pressure. You should feel a small balloon filled with water. Place pressure using the palm of your hands. Sustain this pressure for at least 1 minute or until the bladder is empty. Don't put too much pressure, but the pressure should remain constant. This process should not be painful.